Welcome to the 354th Fighter Wing Live Coronavirus Virtual Town Hall. Today is April 20th, and this is our 7th update to the wing. I'm Kay Nissen, and today we have with us Colonel Benjamin Bishop, the 354th Fighter Wing Commander, Major Dr. Trevor Peterson, 354th Medical Group, and later Chief Master Sergeant Stefan Hansen, the acting 354th Fighter Wing Command Chief. We'll be taking questions in the comments sections throughout the show, so please let us know what's on your minds, and we'll be sure to get to those questions as we're on the air. So up first, as always, is going to be the update, and we're going to fill in what all the changes have been from last week's show. So let's start with you, Doc. What is the update from the medical community?
Sure. Thanks, Kay. So as of this morning, the state of Alaska is reporting 321 cases of COVID diagnosed totally. I think the promising news so far is that the local area, kind of the Fairbanks, North Star Borough, hasn't reported a positive case in almost a week, in over a week actually. That's great. It does not mean that the virus is gone, but it certainly does support that the social distancing campaign is effective and helping in the right direction.
That's great. Colonel Bishop, do we have any updates as far as command directives?
Yeah, absolutely. Good morning, and thank you for joining in today. As far as news from the Fighter Wing Commander, there's been no new command directives. We're still in HPCon Charlie here at Eielson Air Force Base. You may have seen there's Alaska health mandate resuming some healthcare services, so there might be questions on that, and we're happy to answer those in this form. Also, you may have seen the Department of Defense Stop Movement Order has been extended. Expect it to be extended through 30 June. We're still waiting for that formal order to be signed, and as soon as we get it, we'll obviously translate that into a command directive if it is appropriate for our folks here at Eielson Air Force Base. But the bottom line is you're doing great. We are doing a great job as a community, as an installation, combating COVID, and we need to keep it up. So it's important to maintain good social distancing. There's a tendency to kind of relax a little bit when we hear all this good news, and we can't afford to do that. So continue to maintain that social distancing, good personal hygiene, wear a mask. Everyone in the studio here is wearing a mask when you can't maintain 6 feet of distance between someone else, and that's going to help us battle this adversary and continue to get the mission done. So that's the other thing I'm happy to report is we are continuing the mission here at Eielson Air Force Base in the 354th Fighter Wing to include F-35 delivery. Yes, F-35 delivery is still on track. We're actually in the execution phase of the delivery, and our first aircraft may be here as early as tomorrow afternoon. So as we get into that delivery, there might be some questions, and we're obviously happy to answer those questions. But the big thing is the jets are coming. We're going to start that mission here on the installation soon. And however, as we start that mission, we're still going to have our COVID mitigation efforts in place. So there's going to be no big crowds, no big ceremony in person to see the aircraft, but we're definitely going to document it. We'll have media there. We'll have our public affairs teams there, and you're going to be able to participate virtually in this big occasion for the wing. So bottom line, a lot of good news, and let's keep up the good work.
All right, you heard it here first. F-35s are potentially on the way this week, so great news there. You're listening to the 354th Fighter Wing live digital town hall. We're still taking questions, but we are going to take a break here so that we can start catching up on what you've been sending us. Thanks for listening, and stay tuned.
You know that the best way to prevent the spread of coronavirus is to wash your hands.
Wash your hands.
Wash your hands!
But why? It's because soap, regular soap, fancy honeysuckle soap, artisan peppermint soap, just any soap, absolutely annihilates viruses like the coronavirus. Here's how. This is what a virus, like coronavirus, looks like. It's a bit of material surrounded by a coating of proteins and fat. Viruses easily stick to places like your hands, but when you rinse your hands with just water, it rushes right over the virus. That's because that layer of fat makes the virus behave kind of like a drop of oil. You can see it happening in this demonstration. Oils are just liquid fats. What happens when you pour oil into water? It floats. It doesn't mix. But add soap, and suddenly that fatty oil dissolves into the water. That's because inside, soap has two-sided molecules. One end of the molecule is attracted to water, the other end to fat. So when the soap molecules come in contact with water and fat, these dual attractions literally pull the fat apart, surrounding the oil particles and dispersing them through the water. Let's go back to our coronavirus molecule with that layer of fat holding everything together. When it interacts with soap, bam, that fat gets pulled out by the soap. Soap literally pulls apart and demolishes these viruses. And then the water rinses the harmless leftover shards of virus down the drain. But, and you know where I'm going with this, it takes time for this effect to happen. 20 seconds to be specific. To show why, we ordered this lotion that mimics viruses and their fatty layers. It glows under a UV light. If you just rinse your hands under regular water, nothing comes off. If you wash with soap for just 5 seconds or 10 seconds, your hands are still covered. The virus is still there, able to get you and others sick. But 20 full seconds, now the soap is actually destroying the virus. Hand sanitizer works too because it's mostly alcohol, and alcohol works in a somewhat similar way to soap, breaking down that fatty layer. You need a high concentration of alcohol to make that work. The CDC recommends hand sanitizers with at least 60% alcohol. But even with 60% alcohol, the CDC recommends using soap if you can. If your hands are sweaty or dirty when you use the sanitizer, that can dilute it and diminish its effectiveness. As for soap, just any old soap works. You don't need soap marketed as antibacterial even. The FDA says skip it. There's no proof it's any more effective. Just be sure to wash your hands for 20 seconds. That's happy birthday twice.
Happy birthday, dear. I guess me.
Or the chorus to Lizzo's Truth Hurts.
Straight to my face.
Or Prince.
Raspberry beret.
Or Eminem.
Go, go, only got
Or even Dolly.
Jolene, Jolene, Jolene.
Just as long as it's 20 seconds. And you're using the ultimate virus annihilator, soap.
Welcome back. You're listening to the 354th Fighter Wing live digital town hall. I'm here with Colonel Bishop and Major Peterson. We are in the Q&A rapid fire section of our show. So let's start with what the questions are. The first one we have here from John Sharrow was about the Alaska Fish and Game, saying that you could travel between boroughs to do hunting and fishing. Does that apply to our military personnel here, sir?
So currently no, but that's something we are looking at and making sure that the state guidance and the Department of Defense guidance align. So more to follow on that. If there's any change to being able to travel outside the borough, for example, the fish, will issue that in a formal command directive so there's no confusion.
Got it. Okay. Next question. We mentioned that there was an update on health services from the Alaska State mandate. I believe it was number 15. What does that mean, Doc, for local medical services here on base?
Yeah, great question. So Governor Dunleavy basically has recommended that we can proceed with some elective cases and procedures and visits so long as we can do so safely. The Med Group is currently working out what that means for us specifically, but I do expect we're going to see an expansion of our services in the coming weeks. Really what we're focusing on is staying in step and consistent with our community partners at Fort Wainwright and the Fairbanks area. There's still going to be a focus on telemedicine across all spectrum of care, but we're trying to figure out what we can do in person safely for both patients and the staff. As a reminder, we're still very interested in testing individuals who may have symptoms of COVID-19. So if you do have cough, shortness of breath, or fever, we want you to come to the clinic and get evaluated.
Right, so COVID clinic's still open. Where is that again?
You come to this front door of the Med Group through the main entrance, and you get directed to follow the orange flags around. There's been a low volume in there recently, which is a good thing, but because of that, there may not be somebody in the clinic at all times, so you just need to go to the front door to check in, and we'll make sure someone's there to greet you.
Excellent. So, sir, I think we were talking about, the stop movement order potentially being signed soon, that it was going to extend to June 30th. What is our exception to policy right now? So just a refresher on what we are implementing in place right now for travel and PCS for wing members.
Yeah, so there's a stop movement in place, means we're not doing any travel, official travel, without a signed exception to policy. And the approval authority for that is actually my boss, the 11th Air Force Commander. So if there's travel that needs to happen, the way it works is you work that through your chain of command. It goes to your squadron commander, then to the group commander, then up to the wing level. And then I'll support that and submit it to the 11th Air Force Commander for approval.
Do you have an example of what kinds of things merit exception to policy?
Yeah, a great example is the travel that happened this morning. We had a KC-135 depart from Eielson Air Force Base with 3 F-35 pilots on it. It's to travel down to Lockheed Martin down at Fort Worth to pick up our first two F-35s. So that travel required an exception to policy. So any mission essential travel is going to fall into that bin, or if there is a hardship or humanitarian reason for service members to travel, then those will also be routed through that same process.
And that's for PCSs and leave.
PCSs as well, leave, or any TDYs.
Okay, got it. Well, great. We're still here standing by to take your questions for all our listeners out there. We've got some good news with the F-35s coming. We have potentially some more services opening up at the Med Group. We're going to take a break here, but standing by, you're listening to the 354th Fighter Wing live coronavirus town hall. We'll be back in just a second.
Here's how you can make your own face covering in a few easy steps with items you can find around the house, like an old scarf, a bandana or a hand towel, or you can make a face covering out of an old t-shirt. Fold it to the middle from the bottom, fold it to the middle from the top, fold it again to the middle from the bottom, and again from the top, and then 2 rubber bands, one on one side and one on the other side. Then you fold either side to the middle and you have yourself cloth face covering. It's that easy.
The commanders on base have done a really good job about reducing the amount of people in the work center to the maximum amount practical. This is done to minimize the amount of people that would be vulnerable to get sick. The next step is up to us. In addition to washing our hands frequently, we also need to maintain good social distancing discipline. More importantly, do not come to work when you're sick. If anybody in your work section should happen to have symptoms, but you've maintained good social distancing principles, chances are you're going to be fine. If they happen to go on to later be diagnosed with COVID, Public Health will perform an interview and a contact tracing, looking for any substantial contact that a member has had up to 48 hours prior to the onset of symptoms. If it is determined that you are a close contact with somebody diagnosed with COVID, you will be directed for a 14-day quarantine. If you should have any symptoms while you're in quarantine, you will be tested, and then a contact tracing interview will be performed on you. This underscores the importance of maintaining social distance principles. If COVID should enter your work section, this will minimize the impact on the mission. Readiness is job one, and the continued good health of you and your family members are key to maintaining full mission capability. A common question that I get is, Doc, what if I'm exposed to somebody who is put into quarantine? Don't worry, this isn't like the 6 degrees of Kevin Bacon. If they are later diagnosed with COVID, you will be notified, and you yourself will be placed into quarantine. Now remember, just because you're in quarantine, this doesn't mean that you're going to get COVID. This is precautionary to make sure that you're not going to have any symptoms and to keep you out of exposure with other people if you should develop symptoms. I want you to stay safe, wash your hands, and remember, don't lick doorknobs.
Attention all 354th Fighter Wing active duty airmen. The base commander has restricted all non-essential movement and directed mission essential reporting with an emphasis on teleworking. Eielson Air Force Base is currently in Health Protection Condition Charlie. View an up-to-date list of facility closures at eielsonforcesupport.com. Upon arrival to Hersey Gate, present your ID with the barcode exposed and ready for scanning. Do not depart until instructed to do so. For more information and to receive the latest updates about novel coronavirus 2019, visit eielson.af.mil/coronavirus.
Welcome back. You just heard our very own Lieutenant Colonel Doc Ramage talking about contact tracing during the break there. You're listening to the Coronavirus Live Digital Town Hall, and we are still here taking some rapid fire questions. We've seen quite a few come in during the break, so we're going to get right into them. Sir, Doc, the first question that came in was from Jenny Hartwig. Is the shelter in place still expiring 30 April, or has that been extended?
So the health mandates from the governor haven't been rescinded at this point. I'd have to go back and look, but I don't think the shelter in place was the phrasing Alaska used. But none of the health mandates have been rescinded at this point. The only one that's been changed recently was the Health Mandate 15, which allowed for the opening of some healthcare services when proper protections are put in place.
And I think that kind of kneels into the intrastate travel. So I know, sir, you were talking about that a little bit earlier.
Yeah, absolutely. So we are still in a situation in accordance with the governor's health mandate that we are not to be traveling interstate. So no trips down to Anchorage to do shopping, for example. That would be inappropriate in these conditions. Because we are doing a great job of keeping the coronavirus at bay here in the interior of Alaska, but it only takes a few cases for them to start spreading. So please, disciplined execution of those health mandates when you're off the installation. On the installation, we are still limited movement. In accordance with our Command Directive 14, we are still mission essential personnel only reporting to work. We're still maximizing telework. So even though the cases are extremely low and we're doing a great job, we're going to stay at it. And as those conditions change, we'll communicate those through formal command directives that will be posted, sent down through the chain of command, and we'll also get that information out on our webpage as well.
Awesome. All right, next question is coming from Jessica Honeycutt. Is there any update to spouse access for the gym?
Yeah, currently the gym is still military members only assigned to Eielson Air Force Base. And when that changes, again, we'll issue that guidance through a formal change in our command directive and make sure the word gets out.
All right. Still gym access only for military members. Got it. Next question is from Jennifer Hogreth. Is the HPCon level, we're in HPCon Charlie right now, is the HPCon level related to the DoD stop movement order? In other words, will we transition back to HPCon Bravo on 30 June?
So the health protection condition is a decision that's made locally by the installation commander, so that's me. And that is a kind of a local assessment of the risk to coronavirus and the measures that we need to take here in the installation order to mitigate it. It's obviously related to the stop movement order in that both are measures to combat coronavirus, but they're not directly linked in terms of that decision. So the way that works, just for your situational awareness, is we get our group commanders and our leadership team and our public health team together, usually virtually, since we're not meeting in large groups, even as command teams. And they provide me a recommendation, and that is how that decision is made. When a health protection condition change is made, again, that will be issued through a formal command directive, and we'll make sure we get the word out publicly as well.
Yeah, Doc, can you just give us a good review of what HPCon means again? I think, we've almost become normalized to the fact that we're in Charlie, but these conditions are actually really based from the medical community.
Yeah, absolutely. So your health protection conditions are really created to reflect the force protection conditions that the military is accustomed to, but the force protection conditions don't necessarily apply real well to health threats. And so the DoD developed the health protection conditions to help explain kind of where we're at. Alpha being that there is a threat out there, Bravo meaning that the threat could be in the area, Charlie meaning that we're seeing illness generally related to the threat, and Delta meaning that we're seeing severe illness or death from the threat. Those are broad strokes, but that's kind of what we're looking at. And so all of our hope is that eventually we'll start de-escalating these HPCons, but that's going to have to be a strategic decision made by Colonel Bishop in the setting of kind of persistent reassuring data that we're hoping we will get in the future.
Awesome. We're getting a lot of rapid fire questions right now, and actually, Doc, a lot of these are going to be for you. So first question is from Rachel Hans. just now jumping on, was wondering, what do I do when my babies need their shots up to date next month?
Absolutely. So immunizations is still available. It's accessed through the family health clinic. If you want to make sure that we bring you in at the right time, call the clinic first and ask for appointment or to leave a message with your care team, and our team will happily guide you through when to come in and how to get those accomplished. But to be clear, the clinic is still open. We're still here for your healthcare needs, to include routine childhood immunizations. We would like to minimize your risk and your child's risk by coming into the Med Clinic at certain hours, so call ahead and we'll make sure to arrange those for you.
Awesome. Yeah, I saw Amanda Ray Bjorn had a pretty similar question, so I hope you knocked out 2 questions there with one stone. Another question, Alexandria Sorensen, if our appointment is deemed not essential, will the clinic call us to cancel?
Yes, if you have an appointment, assume that appointment is taking place. We should reach out to you. I don't think that we are necessarily classifying things as non-essential at this point. What we're trying to do really is maximize those appointments over the phone if we can. There are obviously some things that we're not going to be able to do over the phone. And if you have a medical need that we can't meet over the phone, we still plan to bring you in. That decision to bring you in and see you face to face will be based on your doctor or your primary care manager's decision after discussion with you and your care team. So if you have an appointment on the books and you haven't been called by your care team, assume that that's still a valid appointment and come to the Med Group.
Fantastic. All right, another question that we have here from Sabrina Finklia. I see kids playing outside but have kept mine in. Are the kids allowed to go out and play with friends, or is that still a no and playgrounds are still closed? I think that one will be for you, sir.
Yes. So yes and no. So in accordance with the command directives, people can go outside to exercise, and that includes kids. So this weekend, my kids were outside playing. Was throwing a ball around with them actually yesterday afternoon on the street. However, what we have to do is maintain social distancing between others. So families can play together, but you should not be having your children play with other children. Because that, again, creates the environment where coronavirus could spread, and we need to mitigate that. So go out, get some exercise together, but maintain good social distancing.
Oh, perfect. Sir, I know we wanted to talk a little bit about, not only on base and being outside and about, but, if people have significant others, if you will, downtown in the Fairbanks area, close friends, are they allowed to visit them, because we are in the local area, Fairbanks is in the local area, but are they allowed to see those people?
So again, social distancing is still in place. So if there's somebody that does not live under your residence, then you should not be visiting them closer than 6 feet. So really we need to be staying at home and really only going outside in order to secure those essential supplies that go in the grocery store, etc. Going to work or going outside to get exercise, or if there's medical treatment that you need. So we do still need to minimize that. Even though we're doing a great job and even though the cases are low, we need to stay at it until we get the formal change of posture that are issued through those formal command directives.
Speaking of command directives, there were some questions with masks that came up. So I think we've been wearing masks or had an order for masks for almost 2 weeks now, and people are starting to get used to them. Are these things that you have to wear while transiting? So if you're in a vehicle with someone else, do you need to wear a mask?
So it depends again, right? If you're in a vehicle with yourself, obviously you don't need to wear a mask. If you're in a vehicle with your family or somebody that you reside with, you don't have to wear a mask. However, if you're with somebody else and you're within 6 feet, especially for a work-related event like you're in a GOV, then it's really hard to stay 6 feet away from somebody in a vehicle. So in that case, Command Directive 17 does apply, and you need to be wearing a cloth face mask. So again, when in doubt, wear them. They are required to enter the commissary, to enter the BX and the shopette. So everyone should have one, but for some reason you don't, please contact your supervisor, your chain of command, or your first shirt. We have plenty on hand, and we can get you a cloth face mask to ensure you're protecting others around you in this environment.
All right, perfect. Well, great. Those were awesome questions from the audience out there. we're going to keep pressing with this live digital town hall. Thanks for listening, and we're going to take a break and see you here shortly.
Anything that makes me feel like I'm kind of going on an adventure, even if I can't leave my house. Listening to true crime podcasts or investigative reporting podcasts or something that just makes me mentally invested makes a huge difference.
I have one tip for surviving work from home, which is currently making dinosaur sounds. Puppies is the tip. Dogs. Okay, guys. Oh, can I have some kisses? Oh, right on the lippers. And if you don't have dogs, I don't know, consider adopting a dog or a cat. You know, you're gonna be at home for a while. Now's a really good time to like bring a pet into your family if that's the right decision for you. I know a lot of shelters are super full as well right now, and they're having to close down because there's no volunteers. So there's no better time than now to adopt. And if you already have a pet, enjoy all the snuggles and unconditional love.
My tip for social distancing is to have a running video chat with a friend or friends. It doesn't even matter if you're talking all the time or not. It's just helpful to know that someone's there so that if you have a funny tweet or you are listening to a really good song, you can share that with someone immediately, and it just feels good.
What am I doing to maintain normalcy during this pandemic? I am baking, and today I'm making lemon bars. Baking is good because I think that it takes a lot of time during your day and it's a good stress relief, and you end up with something that you can eat, which is the best part.
How I like to blow off some steam is to play a video game.
The first one is to buy my coffee and foods from the local stores who are suffering the most because they are either closing or receiving less customers. We already have coffee at home, but we thought it was a good move to help them as much as we can.
Puzzles. This puzzle is going to change my life. It's awful and it looks like it's going to be a lot of work, but again, anything that makes me feel mentally invested in something, like I have a project, like a puzzle, makes a huge difference.
Hey guys, so one way I'm practicing social distancing and also keeping myself centered in these chaotic times is getting into making my own cocktails at home. I stock up on some bourbon, some simple syrups and fruits, some wine, and I'm excited to see what I make.
I'm coping with social distancing and processing this strange time in our world by setting a creative challenge for myself. I've decided to draw or write something down in my sketchbook every day as this crisis continues to keep track of how I'm feeling and use a creative outlet to process my anxiety. I have my colored pencils and I'm ready to go.
It's very important, like you've all heard, to maintain some semblance of a daily routine. One way that I'm managing to do that is to set some goals. For me, having a clear mind is also having a fit body. And one way that I'm staying social amongst all this also is by doing this fitness challenge with a bunch of friends. I am trying to run every single day, do something active once a day, and that counts as going outside and going for a run, or even if I'm stepping outside on my roof and doing some jumping jacks. I know vitamin D is very important still, and talking amongst your friends about this is important too. We're gonna do daily check-ins and then weekly progress reports. So hopefully when we emerge from this kind of cocoon, we come out as butterflies.
Welcome back to the 354th Fighter Wing virtual town hall. During the break, we said goodbye to Major Trevor Peterson, our public health officer, who's given us so many great answers and great talking points. So thanks to the doc for stopping by. We're now welcoming Chief Hansen, our acting 354th Fighter Wing Command Chief, and we're really going to talk a little bit about mission in this last segment here. So, you know, Chief, we were talking about how it can be a little bit hard to balance mission with all of these health mandates, and because, I mean, this is our 7th town hall, we're getting close to almost 2 months of dealing with this pandemic. Do you have any advice for airmen who are just, you know, maybe getting a little complacent or a little bit tired of having to balance both the mission and also wearing a face mask or social distancing while they're at work?
Sure. So I think perspective is important here. When you look at the priorities Colonel Bishop put out, his number one priority is taking care of airmen and their families. Number two is getting after the flying training mission, the alert missions, those types of things. Number three is taking care of the local community and our partnership there. So I think when you define mission, it's important to look at those priorities. And honestly, our mission right now is not to spread COVID. And that is kind of the top priority. So it's very easy to kind of get stuck in that rut of, hey, I'm going to work today or I'm sitting at home today, and that's my mission, teleworking or going out and doing my daily job. But actually mission becomes more, and it's a bigger piece of that. So it is important to remember that. It's also important to remember the potential impact that you could have by not following the guidelines. By going down to Anchorage and coming back, or not wearing your mask when you're supposed to, the potential impact is much larger, because by bringing the virus back and introducing it to the base, you're potentially impacting a very strategic mission. So it is important to keep that in mind.
Sir, I don't know if you have any thoughts on that.
Yeah, absolutely. So it is difficult to get into these new habit patterns of sanitizing your hands while washing it, or using hand sanitizer if you don't have soap and water nearby, not touching your face, wearing the face mask. A couple times I've had to actually start pulling out of the driveway, and I need to go back in and actually get my mask, just because that's just not in my habit patterns yet. So it's important to back each other up on this in these environments, because we're all human. We all make mistakes. But as a team, we are doing a great job getting through this, and we just need to reinforce each other in making sure that we're all adhering to those guidelines. Because like the chief just said, it only takes a few cases for coronavirus to be in the community and start spreading around the base, and that puts our mission at risk and our people at risk. So that's just kind of that focus. We're in the Department of Defense. We're in the Air Force. We do hard, right? We do things when we're contested, and right now we are contested by coronavirus. And this is a threat. This is an enemy. So it's important for us to do our duty in battling that enemy.
So I know at the beginning of the show we talked about some great news that the F-35s are potentially coming here this week. I was wondering a little bit about what that's going to look like for us and what that really means. I know when we just talked about how there's a lot of mission going on, and we're still trying to do that and maintain healthy airmen. But let's transition to what the F-35s mean when they actually get here.
So I will say, when the F-35s land, and again, it could be as early as tomorrow afternoon. Really, I have high confidence that it will be sometime this week. It is going to be a historic moment for the 354th Fighter Wing, for Eielson Air Force Base, for the Fairbanks North Star Borough, Alaska, and the entire Pacific Air Forces. So it's an exciting time, and it's a reflection of all the work that has gone into making this event possible. As we all know, there's been lots of construction going on for really 4 years to make this arrival happen. Meanwhile, we've been onboarding new personnel, and new people and new families are continuing to flow into Eielson Air Force Base, even amidst this COVID pandemic. And as we look forward, we're going to capitalize on this mission to really continue to grow as a fighter wing. So as you look at that mission, with our 18th aggressors here, with our Red Flag mission, we prepare U.S. and partner forces for 21st century combat, and that mission is going to continue. But when those F-35s land, it's a symbolic assumption of a new mission to project air power and support of worldwide operations from the top of the world here in Alaska. So it is an exciting time, and it's something for us all to take pride in, and we are going to continue to accomplish that mission even as we continue to battle coronavirus.
Chief, you have any thoughts on this mission?
I would just echo the boss. This is exciting, really exciting times. As early as tomorrow, but potentially this week, we're going to witness history with the arrival of the F-35. And I think that's really cool. Like something that's been going on for so long, you know, a 4-year buildup, and we're going to see it here soon. And even more so to show that the mission is going on and that we're still taking care of business and we're still doing what we need to do here. I think it's awesome.
Yeah, fantastic. So, sir, I'm going to say that it's time for some last words. For all of those of you who are still typing in questions, we're going to get to those digitally through the comments thread, but wanted to give an opportunity for last words to Chief.
Sure. The only thing I'll say is keep pushing. To echo Colonel Bishop again, keep pushing, keep the goal in sight, and the goal is to follow the command directives, avoid catching or spreading COVID, and take care of yourself mentally as well. You know, get after resilience. So we have the COVID threat right now. We also have breakup season. There's a lot of things going on that are in our kind of in our mind right now. So take some time, get after those things, but just stay strong and keep pushing through this. Make sure we're following the command directives, but also make sure you're getting out and doing some fitness stuff, you know, while socially distancing, getting out and doing some things with your family as you can fitness-wise while following the rules and socially distancing, and just take some action and do something in that regard.
Sir, last words for you.
So just first word that comes to mind is gratitude. Thanks for tuning into this town hall. Thank you for taking an active part in battling coronavirus. Thank you for the great work that you're doing, getting the mission done while also taking care of yourself and those around you. We are doing a great job and we need to keep it up. And that is how we're going to take care of our airmen and our families. That's how we're going to continue the mission and support the local community as a whole, which is our priorities in these times. Look for those opportunities. Like the Chief just mentioned, look for opportunities to connect. Again, we're social distancing, but what that really means is we're physically distancing. What we need to be doing is socially connecting closer with each other than any time, you know, in recent history. So although we're staying apart from one another, it's important for us to really look to connect at those deeper levels. I will say this personally, I've been, you know, FaceTiming my parents a lot more than I have in the past. So this is a great opportunity to really reinforce those ties, reinforce those connections, and support each other, because this is a shared human experience. Everyone is being impacted by coronavirus. And we're going to get through this together, and we're going to continue to thrive even in this contested environment. I'm confident we're going to emerge from this stronger and more resilient. And then finally, just think of our duty. Again, we're all part of a cause that's larger than ourselves. So thank you for taking that duty seriously, for following the command directives, for getting after the mission, and supporting each other through this.
Excellent. Well, with that, everyone, this is the end of our show. Thank you, Chief Hansen. Thank you, Colonel Bishop, for being here with us. I know out in Facebook land right now, thank you to our commanders who are helping to answer questions, Colonel Anger, Colonel Fecky. Please keep putting your questions here on this thread, and we'll get to those and make sure that we get you good answers. Please, everyone, stay healthy and take care. Thanks for listening, and have an excellent week.